number of babies being born with opioid dependency is on the rise, according to a new study. The proportion of infants diagnosed has spiked, and not just inside larger cities. CBS 42 News reporter James McConaughey in studio with us tonight. James, you had a chance to speak with UAB doctors. What did you find out for us?
Yeah, that's right. The study not only shows that there's an increase in the number of babies born with a drug dependency, but that increase is higher in rural America.
Many different drugs can cause this, but the drug which has really gotten our attention in the last few years are those in the opioid class.
Dr. Stefan Kertész is an associate professor in the Division of Preventative Medicine at UAB. He's an expert on opioids.
Fentanyl or heroin, hydrocodone, which is manufactured and sold under the name Lortab, Percocet. Those are the kinds of drugs that a lot of people have developed a real substance use disorder with.
Pregnant mothers who abuse these drugs pass their dependence to the baby. He said it's very important to understand these babies aren't born with an addiction, but they are experiencing withdrawals.
They might cry more, they might be irritable, and they might have fever, but they require much more care and attention.
We've seen drugs trend throughout here for years and years. But, the heroin trend has come back.
Yesterday, we told you about the arrest of 4 people in Etowah County. They were all charged with drug trafficking, in addition to other drug-related crimes. Heroin was recovered during one of the busts. Etowah County Sheriff Todd Entricken said they are doing what they can to take drugs off their streets, but it's an ongoing battle.
It's a problem, and it's not going away anytime soon.
Dr. Kertész said law enforcement is only one piece of the puzzle.
Most policy experts would say that you'll never get a handle on this problem entirely by controlling the supply, because there will always be new supply.
But he said there is hope, and steps need to be taken sooner rather than later.
We have to quickly expand access to treatment. In a state like Alabama, as I mentioned before, access to subsidized medical therapy for addiction is pretty much non-existent. And there are states where that's not the case, and we need to work to emulate that pattern.
The doctor also told me that there is no evidence that a child born with a drug dependency will have that addiction later in life. He said the withdrawals are treatable. Live in the studio, James McConaughey, CBS 42 News.